Tess Wilson. Tess is the Deputy Director of the Library Freedom Project. She is a librarian who loves talking loudly about digital literacy, equitable access, and citizen science. Most recently, she was the co-author of an ALA United for Libraries action planner and contributed to a chapter to ACRL's Data Literacy Cookbook. Outside of this work, she is a PA Master Naturalist and mentoring trainer with the Mentoring Partnership of Southwestern PA. In her spare time, she enjoys volunteering with her local watershed and making art of all kinds. She collects big books and small rocks. Tess, I will pass the mic to you now.
Thanks so much, Deborah. Hi, everyone. Thanks for welcoming me today for this workshop. I'm really excited to talk to you about health data privacy in the library. Here are our objectives for the day. I hope by the end of today's workshop, you'll be able to identify points of vulnerability in interactions with patron health data, and indeed with our own health data on our digital journey. I hope you'll be able to understand ways that library staff can support our communities while they seek digital health information. I hope we can learn about teaching privacy to staff and to the public. I hope we can gain some tips and tools that we can share with our patrons to support their data privacy and digital learning. And I hope we can learn some practical approaches to library spaces, to our policies and procedures as a way to maximize privacy. And a quick agenda here. I'll do a short introduction. We'll talk about what health data is, when it's vulnerable, and then where libraries come in. And we'll have some time at the end for Q&A. But before we really dive in, I'd like to introduce myself and my organization. So my name's Tess Wilson. I use she, her pronouns. As Deborah said, I'm the Deputy Director of Library Freedom Project. But before that, I was a health sciences librarian with an LLM at the University of Pittsburgh in Pennsylvania. I also did my MLIS there, my Master's in Library Science there. And it was during that time that I got interested in the intersections of privacy and librarianship. I was a research assistant with the Youth Data Literacy Project, which took a look at teens and their relationship to privacy, as well as the ways that youth services librarians can integrate those conversations into programming. During that time, I also got involved with Library Freedom Project through their Library Freedom Institute, which is a 6-month-long intensive where we learned about privacy and the library. And I continued volunteering as a trainer and advocate until taking on my current position. So at NNLM, as a health librarian, I also trained library staff, community organizations, and really anyone else who was interested in navigating the National Library of Medicine, and needed ideas about how to incorporate health information into their library practice. And digital literacy was a big part of what I shared with learners. Because we live in a digital world, practices and processes regarding privacy change daily, and they get more and more difficult to navigate. I consider digital health to be something that impacts all of us, especially vulnerable populations. So our seniors, young children, our immigrant and refugee neighbors, and a lot of other subsets of our global community. So I want to preface this workshop also by saying something that Deborah acknowledged and that we acknowledge a lot in the Library Freedom Project community. I'm not an expert. It's really hard, maybe impossible, to know everything and become an expert in something, especially like privacy that changes, as I said, almost daily. What we can do, though, is keep learning, keep sharing, and equip folks with the tools and techniques that they need to combat surveillance, to manage their own privacy. And that's what we're here to do today. So I also wanted to do a quick, short introduction to Library Freedom Project in case some of you aren't familiar. Library Freedom Project is a community of practice that teaches librarians about surveillance issues, privacy rights, intellectual freedom, and other issues that align with the values of our community. The project began in 2015 when we gained recognition for our fight to support public libraries that were serving as public tour relays to preserve patrons' rights to anonymous internet access. If you're curious about the Tor project, I highly recommend looking that up. It's a really fascinating system and sort of a really awesome network of volunteers that run the Tor project. But since then, we've been working hard to fight against these kinds of threats to privacy, and we do so by creating a growing network of information professionals through trainings, resources, community building efforts. And this includes presenting at conferences, organizing protests at conferences, facilitating learning opportunities all over the country, and contributing to publications, other professional platforms. Like I said, it's hard to become a true privacy expert because our digital world is constantly changing and there's new considerations all the time. But this community helps us all stay informed. And this is the Library Freedom Project teaching philosophy. And this is sort of a framework for our conversation today and an introduction to the way that we think about teaching privacy. So we believe it's possible for people and our communities to change. We affirm that people are the experts of their own lives. We believe everyone brings something to the table. We recognize power dynamics, not just in the world, but in the room. We're ready to take risks and willing to be vulnerable. We challenge dominant ideologies and systems of oppression, and we recognize trauma and how it might play a role in privacy issues. So I just want this to set the stage. I'll refer to this towards the end of today's workshop as well, when we think about how we might teach privacy and talk about privacy in our communities. So let's dive in. What we might cover, some things you might already know today, but I think it's worth it to ensure that we're all working from the same glossary, that we all have the same information. So keep that in mind as I move forward today too. So what is health data? As you can imagine, there are a ton of places where issues of privacy and health information intersect. Digital health information seeking brings with it some really specific privacy concerns, and those are amplified for members of marginalized communities or folks who have been historically underrepresented or ignored by medical history. So first, just as an example, let's take a quick look at an often confusing, often misattributed act, HIPAA. Becky Huse wrote a piece about HIPAA and libraries for ALA if you're interested in learning more. That's a great article about HIPAA, but here are some basics. So the Health Insurance Portability and Accountability Act, HIPAA, governs the handling and processing of protected health information in the US. HIPAA's scope includes covered entities, which are hospitals, health insurers, healthcare clearinghouses, as well as business associates. So that's any person or organization that works with that information on behalf of those entities. HIPAA's privacy rule and security rule, along with HITECH, require covered entities and business associates to follow strict rules and procedures to protect patient information. Now, HIPAA's scope does not extend to the majority of libraries unless the library in question is part of a covered entity or business associate, like a hospital library. Traditionally, the extent of medical data collected by libraries comes in the way of a user's activity in the library, like using health resources and attending programs about health topics. In addition, libraries might also retain some health-related information through certain ADA accommodations for library users or staff. This information, while it isn't covered under HIPAA, should also be given additional protection from potential improper use or access by staff or the public. HIPAA was enacted to protect employees with pre-existing conditions from losing their insurance. So that is another piece of data that might exist there too. So that's just an example of something that is maybe misunderstood. Maybe we know what HIPAA is, but somewhere where the library and health data might intersect. And for a lot of us, the definition and difference between what I was talking about with the definition of HIPAA, PHI, protected health information, and PII can be a bit confusing. So I'm going to go over those really quickly as well. So as we talk about privacy in health information, I'd like to introduce you to this term. This is personal identifiable information, PII. And that's information that can be used to distinguish or trace an individual's identity, either alone or when combined with other information to a specific individual. So some information that is considered to be PII is available in public sources like telephone books, public websites, university listings. That type of information is considered public PII. It could include your first name, your last name, your address, your telephone number, email address, education credentials. Examples of more sensitive PII that might not be part of that public search, but might be your mother's maiden name, your driver's license number, maybe credit card information. That would be sensitive PII. Relatives' names, biometric information. So that would be thumbprints, other things that have to do with your body. Home or cell phone number, passport information, your date or place of birth, and any other information that might make your personal identity easily traceable. Now, protected health information, this is what is covered under HIPAA. So that's patient names, geographical elements, so like street addresses, zip codes, dates related to the health or identity of individuals, telephone numbers, email addresses, all of this information here. And beyond that, there's other personal data that might be potentially at risk during our health journey. So one specific piece of data is location. We know that our devices track us, even if you turn your phone off or stick it in a Faraday pouch, which is, if you're not familiar, a way to shield electronic devices. Really fascinating if you want to look that up, and a fun activity to bring to your library. But when you turn it back on after putting it in a Faraday pouch, it will ping a cell phone tower or a Wi-Fi network. So it's very hard to stop location tracking. And each phone has a unique identifier. So we know that Google records location, even if you ask your Android not to. So different parts of your phone might be tracking you, even if you ask certain apps not to. An iPhone leaks a little bit less data, but that's not necessarily true for all of its apps. Another thing is your texts. Your texts, as we are more familiar now, not all messaging apps are equal. So especially when it comes to privacy. So your texts might not be as private as you think they are. It might be worth looking into end-to-end encrypted messaging apps. So a lot of personal data that we don't think about as health data might also be used, could be used to connect with our health data to identify us as individuals. So this complicated web map is from the Data Map. You can check out that resource by yourself at thedatamap.org, and we'll be doing a short activity in a bit where I'll ask you to go to that site. But this is a research project in the Data Privacy Lab, which is a program in the Institute for Quantitative Social Science at Harvard. It's a good illustration of how vulnerable our health data might make us. A fascinating part of this website is the mobile health data page. So here you see a chart that reveals what companies or domains receive sensitive information from Android apps. A lot of these are health apps. It's kind of hard to see on the left and right hand sides of this. But like I said, we'll dive a little bit deeper in a bit. But a lot of these health apps, like Map My Walk, Nike Running, GoodRx, those are pretty popular health apps. And you can see they are connected to these different companies. So when you interact with an organization, you often leave behind personal information. The receiving organization might also then share that information with other organizations without your explicit knowledge. So that hidden data sharing can also cause harm by making personal data available to third parties without your knowledge. And it can also make it difficult for third parties with a legitimate interest in your data to obtain it in ways that benefit you and society. So this tool allows you to take a closer look at your data flow. And as you can see, one of the biggest points on this map is discharge data. So let's take a closer look at that. Hospital consortiums or entities authorized by the state receive patient health data from providers like hospitals and physicians and distribute that information to researchers, companies, public health departments, the CDC, And states and hospital consortiums receive patient health data from providers. In lots of states, they make that data publicly available once certain identifiers like name and birth date have been removed or made less detailed. So if we take a closer look at North and South Carolina, we can see what information is shared and how. This is a great tool for anyone who's curious to know more about how your health data flows in your state. So for $50, the folks behind this tool, the data map, purchased a publicly available data set from Washington State. And it contained, as you can see on the left, patient information that didn't include name and other personal information. It included the length of their stay, when they checked in, what they were treated for. And then they also found this newspaper article that's publicly available, and it became very easy to identify who this person was. So this was a pretty simple analysis, and it uniquely and exactly matched medical records in this state database for 35 of the 81 sampled news stories found. This was in 2011. And those newspaper articles put names to this patient data. So without a ton of effort, our health data can reveal a lot about us, especially if it's paired with other personal data that exists. And this is another example of kind of what that information looks like. You can see how this kind of data doesn't necessarily reveal someone's identity on its own, but as we saw in the previous slide, it could be combined with other PII to identify an individual. And all that heavy information leads us to why all this matters. So I know I've given you a lot of information so far, and some of this is pretty overwhelming. So where do we come in as library workers? How can we help our communities understand and mitigate the risks involved with sharing health data? I highly recommend, there was a great webinar from NNLM, Reproductive Health and the Reference Desk, and that was presented some point last year. I highly recommend that that NNLM webinar as well. But what's at stake if someone does get a hold of our health data or personal data, and why should we care? Let's go back to our definition of PII. So this is any information that could be used to identify an individual. Keep in mind some information where you were born, for example, it might not constitute PII, as it wouldn't on its own allow someone to identify you. But if someone can get a hold of several pieces of that information, it makes it easy to identify you. So that's what we're worried about when we talk about the risk involved with using health apps and other vulnerable points in a digital health journey. Some of the players that might want to access your data include financial institutions, researchers, analytics companies, law enforcement agencies, media companies, law firms, and there are larger, more concerning issues as well. So those could be medical identity theft. That information could affect your credit and everything associated with that. That information could impact your insurance rates. You could face discrimination based on race, ethnicity, gender, your health history. And of course, there are concerns about targeted advertising. So clicks and views get filtered down into tailored ads and content gets pushed to us based on our interests. And ad brokers use health information for targeted advertising. So an example of that is companies can determine if someone is pregnant or trying to get pregnant so that they can advertise pregnancy-focused tools and shopping lists, etc., to them. So this might seem helpful if a little creepy, but imagine if that person is in an abusive relationship and that information might get them hurt, or if they lose the pregnancy. This could quickly become a personal and very harmful privacy risk. Another example might be exercise apps that are targeted to someone with body dysmorphia or an eating disorder, or online snake oil being peddled to someone who is really desperate. We have to remember that not everyone is affected by health data surveillance in the same way because of gaps in understanding privacy policies, because of gaps in health literacy and access to reliable information. So we have to consider all of that in context with our existing systemic issues that disproportionately harm marginalized groups. Now, some points of contact involve your personal information being accessed by someone or a company that is specifically relevant to digital health information. So those could be online intake forms. So when we fill out our intake forms, a lot of which are online now or on our phone, we provide a lot of personal information. And that includes maybe our medical history. Digital health programs are another point of contact. So health programs like Noom or other digital plans can collect personal information, even health records sometimes. Medication services, so like prescription discount programs, often require some personal information in order to access your health history and your insurance information. And speaking of insurance, insurance paperwork is another point of contact. Our insurance companies are often online now, maybe even strictly online. We might receive digital health insurance cards, or we might need to link to our doctor's office, send sensitive forms. And that also brings me to digital health privacy concerns like sending PDF forms that include health information or PII, or faxing those from a place like a public library to a doctor's office, to insurance holders, and consumer genetic research or DNA tests is another avenue of another point of contact for personal information. So I wanted to show you something that we talk a lot about in Library Freedom Project, and that's this privacy risk versus personal reward equation. And we can apply this to health data, like vulnerable points in our health journey. So almost all of us use smartphones, tools, apps to connect with people, and that includes health-related devices. Some of the same features in apps that enhance the convenience for some can also put other people at risk. So, for example, a person being stalked or experiencing intimate partner violence or an undocumented immigrant could have a very different risk profile than a wealthy citizen in a stable environment. So one great way to think about this and to think about the pros and cons of certain tech is to create this kind of list for certain services or tools. When we teach privacy workshops, we sometimes ask people to pick one side to argue and give them 5 minutes or so to talk about whether or not the convenience of certain tech is worth it in their minds. So feel free to take that activity back to your communities, back to your staff. It can result in some pretty interesting conversations because that's kind of what all of our privacy education is really about, equipping folks with knowledge they need to make their own decisions about privacy. Some of the health related examples of these conveniences are on the slide. So I'll read through a couple of them. The ability to order discounted prescriptions. That can be really, really helpful. It also might require us sharing some of our health information. Apps that track our walks, our runs, our workouts so they can monitor your progress. That can be really wonderful if you're working towards a goal. It also might be something that you report to work to get a discount on your insurance. On the other hand, that's a lot of location tracking, right? That is a lot of personal information that's being tracked and maintained by some company. A map or a GPS software that stores your common travel patterns, those could raise some of the same issues. And then advertising customized to your interest. So that's another thing that we talked about as well. That could be really helpful because it might give you an ad for Noom, and that might be something that you're really interested in pursuing. On the other hand, that was advertised to you because of specific things that you searched and your online behavior. Telehealth has been used in healthcare for a number of years, but the landscape of telehealth has changed significantly since 2020. So apps served us differently during the pandemic and now still do today. Consumer health apps, for example, are some of the most widely available and used digital tools. And a 2020 Forbes article reported that app usage surged 40% during the pandemic, and it's still quite high. This is actually good timing because the use of those shoots up at New Year's too, at the beginning of a year. We're always really interested in pursuing new health goals, and advertisers know that. So our use kind of rockets upward around this time of year as well. But just as consumers turned to the internet for fitness solutions, wellness apps also surged. And these are just a few of the articles that noted that surge. We're using health apps, and our online presence is sort of inextricable from our health activity at this point. Another place where our health data is vulnerable is through mobile health apps and devices. So health apps collect sensitive information. It could be workout guides, meal or water tracking apps, running or walking map apps, and then also some health tools. These could be insurance specific apps. Mine, for instance, is called My UPMC, and it keeps track of my prescriptions. I can use it for telehealth visits, to message my doctor, has all my insurance information on it, as well as my prescriptions. Might also be employer related health apps, our workout apps, quizzes and games, things like Noom, period tracker apps like Clue and Flow, and then wearable devices as well. So Fitbits, Apple Watches, Garmin's, and again, a timely note, COVID-19 exposure trackers. So those are another online health tool that we use as well. Another thing to consider is who owns these apps. So some apps, we like to say, if it's free, think about what you might be paying with. And the answer usually is your data, your information. We want to think about who owns these apps, because their privacy policies will dictate how those tools collect your data and how they might store and share your data as well. I want us to remember that privacy is a tough subject and it leaves room for interpretation. So it's really hard to come up with what the correct answer is sometimes. So if we are asked a question about these specific apps, we might not know immediately, but we want to be aware of these issues so that we know where to look. We know what to research. And so we're not giving blanket statements about all health apps or all fitness trackers. We're just thinking critically, taking a closer look, and equipping ourselves and our communities with information that might be helpful in protecting ourselves online. And here's a great example of some of the risks of using some health apps. So this was about Flow. They reached a settlement agreement with the FTC after they were accused of sharing health information with third parties and not deleting user data in a timely manner. So we want to make sure that we read those terms of service, that we're aware of what we're agreeing to. And that is another workshop. If you're interested in learning more about terms of service, Library Freedom Project talks a lot about terms of service, and we can do interactive terms of service workshops with you as well. I can give you some activities and things like that. That's a really fascinating topic to kind of dive into. So speaking of activities, I'd like to do a short activity with you right now. Go to thedatamap.org, and I can share that link in the chat, and scroll down until you see the mobile data chart. It might take some navigating, but you should see a mobile data chart. And then use that drop-down menu to find any apps that you're familiar with. And I just want you to put in the chat what information is shared with whom and why is that a concern? So I'll linger here for a little bit while you navigate to that, and feel free to share in the chat as I move on. Right. So as you navigate to that mobile link on thedatamap.org, scroll down, take a look at some of the apps that you might be familiar with or the tools, and feel free to share in the chat what information is shared with whom and why is that a concern. I'm going to move on to the next slide, but feel free to keep sharing that in the chat. So where do we come in as library board? How can we help our communities understand and mitigate the risks involved with sharing health data? Um, one, as we examine our policies and procedures, it's really important to understand how any potential privacy risks exist in our space. We can't really move forward until we understand where those vulnerable points are in our own library. One example that was fairly prevalent in the early parts of the pandemic was libraries asking users to complete health screenings in an attempt to prevent the spread of COVID-19. So that was covered in an article called When Libraries Become Medical Screeners, and that was in 2020. But it went on to talk about how sensitive some of that information is, what we're doing, how long are we keeping that information, who can see that information. And it applies to employees as well. Who can see employee health information when we put our information into those COVID-19 trackers, et cetera. And the article goes on to make some recommendations that library staff need to keep in mind as well. And that brings me to this list. So what we can keep in mind as we consider the health data journey of our patrons, whether it's specific to something like a health screening tool or more broadly within our space, we need to keep in mind the collection of data. So what user data is being collected? Are you collecting data like their name, their library barcode? If so, what's the current need to collect that data? Is all the data that you're collecting absolutely necessary? Are you collecting data that could tie information back to an individual? For example, the combination of date, time, branch location, security camera footage, those could link information to a certain individual. The storage of data. Where are you storing health data? So if somebody is, as a physical example, if somebody scans something or faxes something, or if you're helping someone enter data from paper forms into a database, where is that information kept? How do you talk to users about that? Access, who has access to data in your library? Is that access secured through physical storage, or what access our vendors have is also important to think about how their policy priorities align or don't align with our library's privacy policies. Reporting. Is there reporting that your library has to do, especially with COVID health trackers or things like that? Think about what privacy concerns might be part of that reporting process, what data you report. And then retention and deletion. So how long are you keeping completed health forms? How long are you disposing? How long before you dispose of paper forms? How do you manage paper copies like sensitive health information, sensitive forms? And another consideration on top of what we already covered is the liability of a data breach. So this hopefully will not apply to your library, but what if there's a data breach that involves certain tools? How do you communicate to your patrons, to your community about those data breaches? One thing we can also do is ensure that folks are getting the most reliable information possible. So we can't make personal privacy decisions for our community members, but we can equip them with information with a healthy critical eye and with trustworthy sources. These are just a few of the resources that are available from NLM. First is PubMed. It's the National Library of Medicine's free database of more than 30 million citations to articles in biomedicine and health. And it's used by almost 3 million users every day, including clinicians, researchers, students, other folks from a variety of fields. NCCIH, which is another acronym for you, it's formerly known as the National Center for Complementary and Alternative Medicine. So that's the lead government agency for scientific research on diverse medical and healthcare systems that are not generally considered part of conventional medicine. So they work hard to determine what's promising, what helps and why, what doesn't work, and what's safe when it comes to alternative medicines and practices. So this is a handy tool for your own use, but it's also really helpful when you're talking to library users. Um, I used to work in as a reference librarian in a small library, and I just think about how many times I was asked health information questions that have to do with new or alternative treatments. So this way you can feel confident leading folks to a trustworthy resource that not only acknowledges the validity of some alternative treatments, but gauges harm and benefit through a scientific lens. And then, of course, everyone's favorite NLM resource, Medline Plus. I don't have to tell you much about Medline Plus, but health topics cover a wide range of topics. It's a great place to start. One of my favorite aspects of Medline Plus is the medical encyclopedia. So when you or your community are faced with complicated medical terms or topics, it's a great place to start. It has definitions as well as links to related information. It's a great resource to point people to as they are starting on their digital health journey. There are also health quizzes, calculators, games. That's a really great way to point folks towards a reliable resource, especially folks who might be vulnerable or interested in those kinds of online health tools that might not always be as reliable as the Medline Plus information is. And these topics are all available in multiple languages. Another great resource is the Health and Privacy Project. And that was a webinar series from Library Freedom Project. It was actually an NNLM funded project in partnership with Cherry Hill Library and the Chinese American Librarians Association. So health literacy and privacy in a pandemic world. It's a 5-part series on health misinformation, and the latest in telehealth and digital health. These are all the recordings of these webinars are all still available and are really great to point folks to, and can also be used to build a learning series for your staff or your community. We did this health and privacy resource just so that folks could understand better after this surge in digital health access and tools. We wanted to make sure that we were providing folks with tools that could improve their ability to read, understand, and explain health tools and health questions, and provide a wide range of topics on health privacy issues. So we have different experts that came and talked about different things on those webinars. And like I said, those are still available. Feel free to share those and watch those. It's a great resource for health information in the library. And it also has a really nice privacy guide. So it's a comprehensive list of resources. It has a really handy glossary of commonly used medical terminology, basic information about HIPAA and ADA, tips and best practices for understanding health information, and a guide to evaluating health resources and information as well. And let's talk for a moment now about teaching privacy. So if we are teaching privacy to either our staff or our community, Library Freedom Project uses a harm reduction lens, and we come from a place of care, which sort of guides the way that we teach. Because we believe that everyone's relationship to privacy is individual, and what might feel comfortable for one person might not for another. So when we teach, we hope to equip folks with knowledge so that they can make informed decisions about what they want to keep private and how to do that. So how do we talk about privacy with staff and patrons? How can we teach privacy to our coworkers and our community members? A little later on, I'm going to talk about resources, games, and tools that you can integrate into your programming. But first, I wanted to talk about some of the best practices when it comes to teaching privacy. And for that, we'll kind of go back to the Library Freedom Project's principles that I talked about in the beginning. So understand that people know where they fall on the privacy spectrum and what risks they want to take. So we want to make sure to give them enough information to make their own decisions that align with how they feel about online privacy. So if we are telling them information, they can take it in and then align it with their own through their own privacy lens. We should also acknowledge that all perspectives come to the table, and ultimately understand that diversity makes it a stronger learning environment. So we want to value all of our learners' perspectives. Staying humble, it's difficult to know everything about something, as especially like online privacy. So be ready to learn as you go and challenge your own assumptions. I am sure that today's Q&A, there will be information that I'll have to go out and research and come back to you with. There are a lot of questions that pop up, especially in the privacy world. And it takes a lot of acknowledgement that we don't know everything and a lot of willingness to do research and look up things. Remain optimistic. So remember that we are working towards change and thinking practically. We want to give people real life examples as often as possible and to give people small steps that they can take because those small steps toward privacy can be highly impactful. It's why it's important to stay up to date with new tools, apps, laws, which companies own which apps, because we want to be able to give folks small steps they can take, something they can do right now, today, to make themselves a little bit more safe online. And leading with empathy. So everyone learns and comprehends things through their own lens. We need to remember that there might be certain reasons that someone wants to use an app or someone doesn't want to use an app, or how someone shares their information online. And that is going to be different for every single person. So we want to keep that in mind as we teach as well. One of the hardest parts about teaching privacy is framing it in a way that doesn't strike fear in the hearts of your audience. So we'll start with some reminders of why privacy is important on the positive side. Privacy is a core value of librarianship. It's essential to intellectual freedom. Privacy is the key to free thought and free expression. And privacy is a human right. It's protected by the Fourth Amendment. It's also codified into a lot of other federal and state laws. Privacy is essential to autonomy. It means respecting user content and personal choices. It's the one way that we can allow people agency and to respect their boundaries. Marginalized people, as we know, feel the greatest impacts from the loss of privacy. So privacy is an equity issue. Making privacy a priority at your library is one way to show commitment to diversity, equity, and inclusion. Privacy strategies and tools take some time, but ultimately they take less time than it takes to deal with ransomware, identity theft, doxing, a phishing scam. So if we take the time now, we can hopefully avoid more time later being spent taking care of one of those issues. And remember that data is very powerful. So by prioritizing privacy, we're taking steps to make sure that power isn't misused or abused. And privacy is one way to take back our power from big data companies and other bad actors. So I've talked kind of briefly about some of these, but I wanted to go into more detail about some of the educational resources that you can use in your own space to talk about health data privacy and privacy in general. And these are great for your own curiosity, but I really do want you to be able to take these and use them in your own spaces. So the Electronic Frontier Foundation is an independent nonprofit working to protect online privacy, and they've been doing that for almost 30 years. One really cool resource they have is Surveillance Self-Defense, and that's an expert guide to protecting you and your friends from online spying. You can read the basics to find out how online surveillance works, and they also have tool guides, and those are instructions for secure applications, what they recommend people use. They have further learning sections that go a little bit deeper into that framework. And another awesome thing they have is their security scenarios, which include best practices for specific populations with specific needs. They have one for LGBTQ youth that is particularly useful. So if you work with young people at all, that guide teaches young users how to explore resources online in a safe way that avoids giving out more information than they would like to people who might want to do them harm. This is a great example of what they offer. This is just a playlist of tips and guiding instructions for creating a foundation for your own personal security plan. It has tools to assess your own threat model. And you can learn more about what threat modeling is from EFF. It helps you create strong passwords, design a security plan that works for you. I love sharing this resource, not just with staff, but with community members as well. This makes for a great workshop. It's pretty easy to create sort of a privacy workshop around EFF's resources. And this is one of my favorites, Tactical Text Data Detox Kit. So they describe this as everyday steps that you can take to control your digital privacy. And they have really great toolkits and guides available, and it ranges from beginners to folks who just want to do their own personal privacy audit. It's a super rich resource. Tactical Tech is also the organization behind tools like Me and My Shadow, which is a cool way to explore your data footprint. They have a wealth of really beautifully designed and informative resources, including ways to control your mobile footprint. So that is pretty relevant to our health data footprint because of the way that we use our phones now in so many health applications. And it has scales to use when assessing how secure your accounts are and a lot more. A really great way to, again, audit your own personal security. They have a really nice toolkit specifically designed for youth. If you can't tell, I used to be a children's librarian, so I'm always thinking about ways to engage young people. This is a printable, well-designed guide that provides teens and really anyone. This is super, it's beautifully designed and it's super relevant to, I think, adults as well. So it provides a really nice foundation of knowledge and simple steps to take to increase online security. Safe Data, Safe Families Project. This is another great resource. They've spent years talking to library staff and families about the challenges of privacy in the library. And they have a lot of resources, including, as you can see, games like Password Mania and other plug and play workshops that you could very easily take to your space for patrons or for staff. This could make a really nice activity during a staff meeting. And of course, Library Freedom Project. We have a lot of tools and resources available free on our website. And aside from our online and in-person trainings, we have flyers, zines. All of our webinars are free and recorded, and they are created for the purpose of sharing with libraries. I wanted to point out this resource in particular. It's a guide to evaluating online health information. And you can find that on our website. And then this video, which is available on our Vimeo page, Privacy and Security for Reproductive Information Seeking. We also have a video from one of our crash courses about reproductive and health privacy, which you can also find on our Vimeo page at this link here on the bottom of the screen. And this library telehealth guide. This is a great resource as well. It's a helpful guide as you think about implementing telehealth services in your space. So if you're thinking about creating private space in your library for people to take calls, to access health information, this is a really great guide from identifying need to grant proposals and funding advice. It's a really nice, comprehensive resource. And finally, one important thing we can do in our space is take a look at our own privacy policies and how patron privacy is or isn't prioritized. As we think about our policies and procedures, I want to remind us of this list. How do we collect data? How do we store it? Who has access? What data are we reporting? How long are we retaining it? And how are we communicating if something happens to this data? And here are some guiding questions to lead you as you take a closer look at your own privacy policy at your library. How many years has it been since it was revised? What technology does it cover? This is especially important to consider if you have added a telehealth space in your library, added tools that are used for telehealth. What materials does it cover? What services does it cover? Does your privacy policy cover physical sensitive documents like uploading health information to a digital platform, sending in medical history to a doctor, insurance information if people need help inputting that information, does your privacy policy include that, and what the procedure is to um, retain to access that kind of information? And is it inclusive? Is it accessible? Is it logically written? Does it use inclusive language? How easy is it to find on your website or in this physical space? We like to think about privacy policies this way. Your library privacy policy is only as effective as the person with the least amount of knowledge and experience with them. In other words, if not everyone can understand them, nobody benefits. So keep that in mind as you think about your own privacy policy. Some other best practices when it comes to privacy policies include creating interactive scenario-based trainings for your staff. So these could be scenarios that you present to your staff at meetings, maybe inspired by real events or situations faced by your staff, faced by others. Providing opportunities for staff to discuss privacy-related issues in training sessions, or in asynchronous discussions like intranets or on Slack channels. It might be worth scheduling time into a regularly occurring staff meeting to talk about privacy issues that have either come up or that people might be wondering about. It's a great way to learn about the privacy concerns that all of our staff face. So we might not know, for example, what the front desk folks are dealing with if we're always in the children's section, or we might not know what the security team is dealing with if we're in the back office. So making sure that we have this holistic view of security and privacy at our institution. And then having a regular training schedule for new staff as well as refresher trainings for existing staff. The last thing you want is a situation to arise without the folks involved knowing where to find what they need. So make sure you touch base regularly with your staff about your privacy policy. Make sure that that is accessible. Make sure that they know where to find it on the intranet or on your website, or that it's physically available in the space. So we recommend performing routine privacy policy audits. This is a great tool that we have available. It's a library privacy policy template, a great place to start if you want to do a policy audit. And then this activity, I just want to leave you with as something to take away from this workshop. So locate your library's privacy policy and answer the following questions. And you can do this with your staff. Was it easy to find? Is it written in straightforward language? Is health data specifically mentioned? Given our talk today, does anything stand out to you? And what would you add or change regarding health data in your privacy policy? And at the end of this exercise, you'll either walk away with renewed proficiency in your own policy or some actionable ways to suggest improvement. So if you remember nothing else from today, here are some quick takeaways. Stay optimistic. Remember that we're working towards the possibility of change. We can make progress. I don't want you to leave this workshop feeling defeated or like online health privacy is a big, scary notion. Hopefully you're leaving with some practical resources and some more information than you came here with. And one of the best ways to talk about and teach privacy is to use practical examples and provide practical plans to people. That is how we'll be most effective. And remember, this is a learning process. We might need to take small steps. We need to be ready to learn as we go. We should meet people where they are and work with the goal of empowering them to understand and make changes that make sense to them. And as we meet our communities and teach these things, remembering that everyone brings something to the table and that our assumptions might be challenged, and ultimately staying humble and nimble is a great way to teach and learn. And finally, I would love to come to your library, whether that's virtually or in person, to do a privacy workshop with your community or your staff. If you're curious about what those look like or what we have to offer, I'll just say it's a huge range of formats and topics, from hands-on workshops at in-service days to delivering the keynote at a consortium gathering to guest lecturing for your class, truly everything in between. So please let me know. We're currently working with a librarian who's putting on a privacy series at her university library. So if that's something that interests you, please get in touch and we can think about what that might look like in your space. Thanks so much for joining me today. I think we have maybe a couple minutes for Q&A. Sorry, I went a little bit beyond my time here, but thank you so much.
Thank you. We really appreciated that. Just a heads up before we get into one or two questions, I want to let everyone know that within a week, you will receive an email with a recording of this session, and you'll get a link to a survey about CE credit. So Dacia is going to lead you guys through one or two questions, and then we will talk to you soon.
Fantastic. All right. So you guys have shared some really rich and relevant questions. And so I'd like to pose a few of those questions to test right now.
Yeah.
So first up, I want to let you know you got a little shout out from Cecilia in Topeka. So she was like, I know her. She knows my daughter. So she says hello. And then, and then secondly,
Wonderful.
librarians have some questions about the legal and ethical obligations around PHI that library users may disclose health information to them in the course of, like, an interview. So when they're providing feedback or making suggestions, for instance, if someone says, hey, using PMC instead of journal websites to read papers is better for me because I have ADHD or
Yeah.
something along those lines. Should I make sure to remove the patron's name and details when discussing that with a colleague? And how do we get that feedback without making our users with disabilities volunteer user experience consultants?
That is a great question. If I'm understanding it correctly, I would say this is the right attitude to have when you're thinking about this. So how can we get meaningful feedback um, from users without then revealing their identity because of the information that we've collected? I think that's an awesome question. I think asking the question, is all the information that we're collecting absolutely necessary to this process, might be a helpful way to frame that, and to think about what that process looks like. Also, if you're collecting that data, how can you think about how you might be able to anonymize it, or where in the process of collecting it, it could be anonymized. What kind of tool you're using. So if you're using, let's say you're using like a Google form, think about the privacy implications of using Google for that. If people have email addresses that might be tied to it, you can also turn off email addresses for Google. But thinking about that every step in the process, are we collecting more information than is necessary? Or if this is something you maybe wanted to invite people in to a focus group about this, if people were excited to contribute, that might be a way to do it as well. That's a really great question. I think maybe a more complicated answer than I just gave. But like I said, I think the attitude you have about that is great, to think critically about how we are collecting information about people as they offer feedback, specifically about accessibility. That's such a great question.
Yeah, yes, it was. Now, if a patron asks, can you help me with my patient portal? Is there something that
Yeah.
librarians should stay away from when doing that?
So I think about this a lot because of one instance of many. When I was in the public library, someone was signing up for a Lyft account. And while that's not a ton of personal information, you do have to put in your insurance information. You have to put in your car information, payment information, things like that. So it can be a fair amount of personal information that they're inputting. And this particular patron was not a proficient typer. And so they wanted me to input all that information. That is a difficult situation because you want to help them be able to put in this information. You also want to make sure that you're maintaining their privacy. So I think having that kind of procedure lined out in your policy, in your privacy policy, or having that be a scenario that you work through with your staff. So in this privacy journey, how are we doing our best to protect this user's information? Is there physical record of this information that they are that the library might have access to or maintain? that's a tough question too, and I know that it comes up a ton in the library, especially the public library. That can be a really tough situation, and I think just talking it through with your staff is a great way to go, because we also might not even be aware of all the times that this pops up. I One privacy issue that I realized at a library once, that I had never thought of before, was I was walking by the public computers, and I glanced over briefly, and I saw that I was on the screen walking by this public computer, and it was because the kid that was playing on it was playing Minecraft and had the camera turned on. And so, which I didn't even know you could do. But it was like it was just an instance where I had no idea this was even an issue that I should be thinking about. And I was online as just somebody who was in the library. That was not a big breach of privacy for me, but it could be for somebody else who's in the library, revealing personal information about who's in the library, etc. So that's all to say, there are a lot of instances like that that are specific, and it's hard to maybe give a broad answer to all those instances. But I would talk to your staff, see what instances they face, and then make sure that that is covered in your privacy policy.
And I just wanted to say, this is such a rich topic and there's so much good dialogue. This might be something really great to look into in the future. Thank you all so much for a great conversation. I'm sorry we didn't get to all the questions. Maybe you'll be able to connect with Tess in the future. One last thank you to Tess, and I hope you all have a wonderful day.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.